It's not the first time that we see something like this happen. It's something that we see more and more in emergency rooms throughout Quebec.
A newly released Quebec coroner's report says that gaps in ER services at Laval Cité de la Santé Hospital contributed to the death of a 69-year-old man who had to wait 10 hours without seeing a doctor. Umberto Mastantuano died on February 12th at this hospital, and the coroner says that there were delays in his resuscitation and that he wasn't reevaluated at all during his stay.
He trusted the fact that I'm in a hospital. If something happens, I'm safe.
The coroner says Mastantuano's death happened amid severe overcrowding, with the ER operating at 173% capacity at the time.
If nothing is done to properly evaluate and change dangerous practices in emergency rooms in Quebec, it will not be the last time that we see that.
The report says that Mastantuano was seen by a triage nurse on February 11th, who initially assigned him a priority level number 2, the most urgent level of priority apart from being resuscitated. 7 minutes later, that decision was downgraded to level 3. He was sent back to the waiting room without medication, where he waited for 10 hours without being reevaluated.
If there was any reasoning behind that decision, then at the very least he should have been reevaluated.
Mastantuano had a history of heart issues, such as being treated for arrhythmia, according to his wife. City News contacted Mastantuano's family, who declined to comment at this time, but added that they're aware of the report's release and are upset with the situation.
He didn't think Cité de la Santé was going to fail him.
The Cites de Laval acknowledging gaps in its ER services following the report, adding in a statement that immediately after the event, the Cites de Laval conducted a thorough analysis of the situation and implemented a structured action plan with a timeline, which is currently being monitored and most of which has already been implemented. Patients' rights advocates say that expanding access to home care for elderly patients could help reduce the strain on emergency rooms.
Most of them, let's say 50% of them, if they had been followed at home, they wouldn't need hospitalization, and neither would they need a bed in long-term facility.
They also say the circumstances surrounding Mastantuano's death warrant a formal public investigation, something the Quebec government said in February that it would carry out.
You have to keep up with the elders, make sure that they're fine at home.
In Laval, Zachary Cheung, City News.